Great, welcome back everyone to House Healthcare. We are now still on S37 and taking up sections 11 and 11A. Section 11 starts on page 19. And we have Lauren Lehman with us and Carrie Phillips with us. So I'm just gonna turn it over to both of you to introduce yourselves.
Great. My name is Lauren Lehman. I'm General Counsel for the Office of Professional Regulation.
I'm Carrie Phillips. I'm the Executive Officer for the Board of Pharmacy with OPR.
Great, wonderful.
So we're here to talk about sections 11 and 11A and S37. And Carrie, you wanna?
With respect to Section 11, it amends Vermont law to define and permit pharmacists to prescribe emergency contraception per state protocol, and OPR very much supports this and can administer this.
And for those who aren't familiar, the state protocol is a practice of clinical pharmacy established in 2020.
Yes.
And what's the process for it?
So the process is that we use the public forum of the Board of Pharmacy meeting to have stakeholders attend, primarily through the pharmacists as well as the Vermont Medical Society. And that's where I present a draft of the protocol and collect input and make any amendments as necessary. And then those are ultimately approved by both the Director of OPR and the Commissioner of Health.
Okay.
There's a very specific list in the statute of medications that can be prescribed by a clinical pharmacist or a pharmacist without a prescribing provider writing that prescription. It's in 2023 of the Title 26, and it includes such things as self-administered birth control, and now the proposal is to include emergency contraception in that list as well. So if that's included, the Board of Pharmacy will develop under what circumstances a clinical pharmacist can prescribe emergency contraceptive for the non-over-the-counter types to an individual without getting a prescribing provider's prescription first. And the Commissioner of Health will review that to ensure public safety. And what's the other one? And then the pharmacist will be able to dispense that to the individual without a prescription from a prescribing provider. Other examples include
Tobacco cessation products, epinephrine, and albuterol for emergency situations, dietary fluoride supplements, naloxone. No, I'm sorry. Naloxone and influenza vaccines.
so.
Are the ones that they can already?
That's already
Yes.
ones they could,
Okay.
and the ones to add to that list today would be this proposal. Section 11 would add emergency contraception, a definition of that to the existing chapter, and add emergency contraception state protocols as an option.
So let's stay there on section 11 before we go to 11A. Art?
It looks by the language that a pharmacist may prescribe, but a pharmacist doesn't have to prescribe. Is that correct?
That is correct. There are certain standards of practice that a pharmacist needs to comply with, as in any profession. They're not obligated to under most circumstances.
Okay, so if a pharmacist has a moral opposition to prescribing a contraceptive pill or something that ends a pregnancy.
There's a standard for conscientious objection that I'm not well vetted in today to discuss with you, but I'm happy to get you more information about
Okay,
that.
I like that actually. Thank you.
Ellen?
There's no age restricted of any.
Not on the emergency contraception. It could be restricted in the state protocol that's developed. So if the Commissioner of Health thinks, or the Board of Pharmacy believes that it's clinically inappropriate to offer this service to below a certain age, they could include that in the protocol.
How long does the state, sorry, Brian, how long does the state protocol process take?
It can take a while. We've developed several so far, and it's just a matter of coordination and resources with the Department of Health.
Okay.
Yeah, so I'm aware that there was recently 2 federal court rulings that are in contradiction to each other regarding a drug. I think it's called Mifa. Yes. Is that a medication that is covered by, as considered an emergency? Okay.
It's not considered a contraceptive here. That is not a contraception. It's not emergency contraceptive.
Can you
So-
give examples? I'm sorry. Were you just about to ask
Well, I
that?
was gonna say, so then that ruling wouldn't affect these sections, but I do wanna know that too, so.
I have not reviewed the rulings, so I'm not sure how narrowly or broadly they drafted their findings.
Okay.
So I'm not sure if they would apply, but in terms of what are some examples of emergency contraceptions, it might be.
Sure. There are two oral options for emergency contraception. One is prescription only called Ella or Ulipristal. And then there are some over-the-counter ones. The brand name is Plan B. There are a few other brand names, but it's levonorgestrel.
And those over-the-counter ones would not be affected by this. It would just be the Ella or ULA
Right.
right now.
The state protocol for
The state
prescribing?
protocol,
Yes, yes. Yes, that would be what the state protocol would address, the Ella. And then the others are over-the-counter, so.
Right, so there's no need for the pharmacist to prescribe or get a prescription. It's already available over the counter, or if this passes through a vending machine. So it wouldn't necessarily, would not be impacted by the state protocol. That's simply for those that are prescription only, which today is one medication, but obviously could expand in the future.
Okay, any other
Thank you.
questions in this section? Okay, 11A.
Great, so we're on to 11A. This authorizes retail and institutional drug outlets and secondary schools to make emergency contraception and other non-prescription drugs or articles for the prevention of pregnancy or conception available through vending machines or similar devices. So you can imagine being on a campus, having that available to you. OPR is fully supportive of this provision. The only kind of question we had was about how there's a subpart B authorizes the Board of Pharmacy to adopt rules for the use, location, operation, and oversight of the vending machines. It's a, so the board does not necessarily have to. There are provisions in the chapter already, however, that say that the board may not make rules that apply to the sale of non-prescription drugs. We've consulted with the Legislative Council on this and come to what we think would be a good solution that we'd like to ask the committee about is adding notwithstanding that prohibition on making lot rules regarding non-prescription drugs. The board may adopt rules in accordance with 3 VSA to regulate these vending machines.
And legislative councils?
Yes.
Okay.
Thank you. Jen Kirby, Legislative Council, yes. Lauren and I were exchanging emails and I agree with her read and think that notwithstanding for that specific provision.
And for those who are new, can we explain what notwithstanding means?
Sure, for those who are new.
And those who have been here a while and still don't understand.
Refresh my memory.
Notwithstanding is a term that we use whenever there may, or in this case, we know that there is a provision of law in existence that is conflicting with what it is that you're looking to do. So we don't have to create a carve out from the existing law. Instead, we say notwithstanding, and we try to be, when we can, as specific as possible. So in this case, notwithstanding that provision of law that says OPR cannot make any rules that relate to the sale of non-prescription drugs, the Board of Pharmacy here can adopt rules regulating this piece of emergency contraception and the vending machines.
So it's allowing them to do it.
Right.
Brian?
It's related, but it's a little off. So if you think it's too off, I understand, but I feel like it's a time where I think it's appropriate to ask, because earlier I brought up the issue of, we're talking about reproductive healthcare service. I don't know if that's the language exactly, reproductive healthcare services, and it was very focused on pregnancy. I'm wondering, are there any emergency medications for sexually transmitted infections that are over the counter, or all medication? And if you don't know this, it's okay. but because we can find out later, but I'm just curious, or are there emergency interventions that are over the counter for sexually transmitted infections?
No, I don't believe there are.
Okay.
So I'm wondering, we should add, if we could add like PrEP?
But it's not over the counter. That's the issue. Like you would need a doctor or maybe a pharmacist to do it. So this is what I'm getting at is like just thinking about all access, increasing access to treatment in an emergency involving sexual violence or sexual assault. So one clearly is contraception, but there's people who may not be in a position to conceive, but who might be at risk of getting an infection. And so it sounds like there's no over-the-counter emergency STI treatments, but are there any, so then that leads me to what you were saying, which is, are there any STI treatments that might be appropriate for a pharmacist to approve? And you know what I'm saying? And if you can answer that, maybe we can just get other witnesses or think about it.
I'm not sure we can answer that at this time. We would want to bring in the experts in the field.
And it's not really, kind of doesn't fit with the bill.
It doesn't, we'd have to fit it in somewhere else, but it's something I think we need to be aware of, because if we're thinking about the full impact,
Yeah,
we talked about making sure people have access not only to terminating pregnancy, but to having a healthy pregnancy. Likewise, we should be thinking about people, the infections, the risk of infection from this all.
yep,
So,
yeah, good point.
Okay, so I know there's probably still questions, but I just want to go back to 11A. The testimony is that you're good with the language as long as we add the notwithstanding language, which Jen has.
Yes,
Great.
thank you.
Topper and then Art.
A question about line, well, you don't have it in front of you.
I have it on my phone if you don't mind me.
I'll tell you what it is. It's the use of the word may adopt rules in accordance with to regulate location, operation, et cetera, of vending machines. Do you feel it would be more appropriate to use the word shall there?
OPR's actually asked, the initial draft said shall, and we asked for the may, simply because we don't often regulate the sale of non-prescription drugs. The FDA does. So for most non-prescription drugs, there's manufacturing requirements, there's expiration dates. And so it would be a whole new field of regulation. Who would be responsible for that monitoring? Who would be would that be subject to a licensing requirement, which is OPR's usual role and the board's usual role? So we asked for may. I think over time, we could, if there were issues that arose that would lend themselves to the Board of Pharmacy addressing them, we would take that initiative at that time.
Okay, so you're saying if a problem developed.
Correct. With theft prevention or safety. Because again, these medications are already readily available, and it'd be like buying ibuprofen or Tylenol in most pharmacies, and the Board of Pharmacy regulates the sale and dispensing of prescription medications.
I'm just thinking of, it's a bit different to have a vending machine as opposed to having, you going and you're buying it, you're going up to somebody at the desk.
The inventory oversight is a little different because it's not in a retail location.
Yeah.
But OPR's role has traditionally not been overseeing those retail and inventory issues of like making sure it's not expired and safe.
And so I just want to confirm, this language isn't saying any retail or institutional drug outlet must do this. It may be if they choose, they will come to OPR.
Correct.
And you would move forward.
If they choose, they could, and they could just do it without OPR at this point in time.
Okay, and that if this starts happening and there are issues with safety or then you could do the rules. Okay. That's
I just hate to see somebody get hurt.
Absolutely. And under right.
In a room because
This is an actual increase in the board's authority because right now under current law, the board is not allowed to make any rules regarding the sale of non-prescription drugs. That's under 2032H that we've asked for the notwithstanding regarding. So this acknowledges that that's a different kind of situation when you're offering these medications in a vending machine versus a brick and mortar store, and authorizes the board to make rules if a safety issue arises.
That. Did that help? Question, I had the same question you did, so I had that May circle. So I appreciate what you just said, because it gives you the allowing to make rules, but you don't need to yet.
Exactly.
Got it.
Any other questions, Art?
Yeah, maybe I don't have a question, but how do we, maybe it hasn't been determined, but how are we going to make, I don't know, maybe it doesn't matter to anybody, but are we gonna make sure somehow that these products are just for people that need them? I mean, I don't know. Are these gonna be placed in college campuses? Is that the idea? Or do we know? Or are they gonna be everywhere?
From the language, it's not clear.
Not clear, okay,
And remember, it's over the counter and non-prescription drugs.
okay,
So if you're at UVM now, you could walk to the pharmacy and get these medications.
okay, so they're just another outlet to,
To get over-the-counter medications.
all right.
Right?
Yeah, just, currently, are there places in Vermont with vending machines for other over-the-counter medications that you're aware of, like Tylenol, Advil, things like that?
It's possible. Some institutional hospitals that have institutional pharmacies, some of them have, may have a vending machine type of thing for over-the-counter medications like acetaminophen and ibuprofen for the hospital employees to obtain if they need them. But I don't know how many or if they are in activity.
We don't regulate them.
We don't regulate them, so we don't know what's out there essentially.
But this would, this language would allow you to regulate them if they start dispensing medications related to this kind of healthcare,
Right,
but not if they continue doing what they currently do.
correct. So yes, this would be specific to those vending machines that dispense these products.
So if they start adding to the inventory these medicines, then you may set rules. But if they don't, it doesn't mean you have to go out and start trying to track it down.
Yeah.
We're still, as a state, the policy is to give vendors, I guess I would say, the freedom to sell, vendors who are qualified to sell over-the-counter medications, the ability to use vending machines to do so.
It's a yes, as far as OPR is concerned. So I couldn't speak on behalf of
Okay.
other regulators.
Yeah.
Any other questions? Wonderful. Thank you
you.
very much.
So much.
And we actually do have a long break now. We're not due till 3:45, so
I could do a therapy session with someone.
enjoy your time and we can go offline.